HIP New Jersey talks with Dr. Carmen Romano, owner of Madison Medical and Sports Rehabilitation Center, about your COVID-19 questions. Deneen from Toms River asks, how can we ensure vaccine safety with no long-term or animal testing?
I think someone to watch, he actually did a press conference yesterday regarding some of these things, is Dr. Fauci. He is the leading infectious disease doctor, and I think he's doing an amazing job. But to try to give a simple answer to that, we are fast forwarding these vaccines, and they usually are tested on animals, but because of this pandemic, they are, grabbing volunteers and they are giving the vaccine to a healthy patient first to see if there are any adverse effects to that patient. That takes a little bit. Once they realize that the patient doesn't have an adverse response to the vaccine, they now have to make sure that that patient isn't more vulnerable to the actual virus because of the vaccine. And this has been very common in the past, that some of the antibodies that they treat viruses with leaves a patient a little bit more vulnerable for that virus. So that's why it takes the time that it takes to come up with a good vaccine. You're probably looking at a year before a really good, safe vaccine comes out.
Christina from East Hanover asks, what precautions should we follow when receiving packages and/or goods from the grocery store?
I'd err on the side of caution. I don't think you can be too safe right now. You should be in a pair of gloves when opening a package and bringing it in the house. If it's something that you can spray, I would spray it with some Lysol or some kind of disinfectant, just to ensure that it's not contaminated. But again, I don't think the virus is withstanding a shipment, and then you receive it, and then you touch it, and then you touch your face, and you can contract. They don't have anything related as of yet, but you can't be too safe.
Marie from Clinton asks, how can I boost my immune system?
Obviously, there's a host of ways. If you're not able to get out of your house or are a little nervous on getting out of your house, immune system is immune system. So high levels of vitamin C and zinc play a huge role. Rest plays a huge role. Your stress level will play a huge role in bringing your immune system down. At our centers, a lot of patients are coming in and getting vitamin infusions. Those are your best means to keep your immune system up.
Fred from New Providence asks, what is the correlation between COVID-19 and the loss of taste and smell?
Seems to be a very common sign and symptom. But we're hearing different shifts and shapes of this presentation. High fever, some type of a cough-related symptom. And yes, it seems to be a presentation of loss in taste and smell. But I wouldn't say if you're home with a high fever, not feeling well, but you could still smell, not to get tested. I wouldn't count on that just to be a sign or a symptom of whether you have it or not.
For more on Dr. Carmen Romano and his wellness center locations, visit drcarmenromano.com.